I think this just more and more important as we work with, as the older population grows, but also just for ourselves individually. So I hope you will take a lot of this to heart for yourself individually. Ageism is described as discrimination, prejudice, and stereotyping based on someone's age. Robert Butler is the first person to coin the ageist term. Back in 1968, he was being interviewed about an age segregated housing development for middle income seniors. And the neighborhood was fighting the development of this age segregated housing for older adults. And he was quick to compare it to the other isms, racism, sexism, things like that. And he coined that term. So just think about in your own life what you see in regards to ageist behaviors. It's very harmful to ourselves as well as to the folks that we serve. From face creams to incontinence supplies that are on the TV all the time, with funny birthday cards that we see that we all have participated in, probably laughing and sending funny birthday cards. But I do have to say, I did see a incontinence product commercial recently for a male instead of a female, and I have to say I was relieved to see that targeted it to men as well. All right, so ageism is one of the last socially acceptable prejudices, and I think that's important for us to think about. Racism, sexism, all those isms have been wrong and recognized as wrong for so long, but ageism really hasn't been in the forefront as being unacceptable. So think about that. The World Health Organization does have several reports on ageism and how to prevent ageism and how it impacts others, but they define ageism as pertaining to the stereotypes of how people think, the prejudices, how people feel, and discrimination, how people act, directed at others based on one's age. Ageism really begins in our childhood. It really begins and is reinforced over our life, just like all the other isms, right? Really begins on how we're raised, what culture we're raised in, and how it's talked about at home, how it's talked about at school, how we're impacted. So it's everywhere. It's in the workplace, it's in the media, it's in our schools, it's in healthcare. And it's really something that everyone will experience at some point in their life, but it really needs to be recognized as unacceptable behavior and have an impact on making change. So I hope that you all will take away from this presentation some ways to make change as we interact with people each day. There are many types of ageism, but here's some that were defined by the Institute for Public Health at Washington University. Personal ageism. So just think about that. That's really daily interactions, what you're exposed to each day, the media, the internet, the magazines you're reading. Those are personal ageism. And so how we interpret what we see and read each day in our interactions. Self-directed ageism is really when an individual is exposed to ageist messages and believes these are true. So just think about that. So do you believe you're too old to keep up with technology? Have you said that about yourself? I'm too old to do that. I'm just too old to deal with this. So those are really self-directed ageist comments. And so I challenge you to change that narrative as well. Institutional ageism is really the result of our laws and our rules and our social norms and our policies and practices. So for instance, maybe a company offers training, management training for promotions to young folks rather than older adults. That would be an institutional ageist behavior if older adults were excluded from training programs or something. What about everyday ageism? I think everyday ageism is really the most prevalent. We just see it every day. And if we, as we interact with the world each day, we see that. We'll talk a little bit more about that. Compassionate ageism. I've got to get my mouse to do what I want it to do. Compassionate ageism is the belief that all older people are vulnerable. So think about healthcare. Do we believe, as we're caring for older adults, do we believe that they all need our help in every way? Do we believe that they're dependent on us for everything, or do we encourage them to do things for themselves with us there to assist? Do we ask, can we help you with that, or do we just automatically help someone? And then youngism is just the opposite of what we have been talking about, but it's really discrimination against young people based on their age. They're too young for that responsibility. We can't promote that person. She's just too young for that, you know. So have we engaged in that as well? So here's something survey that was done by the National Poll on Healthy Aging about everyday ageism. So this was a cross-sectional study of 2,000 adults 50 to 80 years old. And they looked at everyday ageism and decided that it was prevalent, and 93% of the participants said that they had encountered some type of everyday ageism. And it's very common. It's worldwide, but especially in the United States that we see. But it really refers to the stereotypes and the prejudices based on age. Some of these, I don't know if you can read them all, but I see and hear and read jokes about old people. You know, that's the top one where over 60% of the people said they had encountered that. I feel lonely. I feel like loneliness is part of aging. That's not true. But you know, over 30, almost 30% agreed that they felt like loneliness was part of aging. People assume I have difficulty hearing. How many times have you been in a setting where an older adult was there and people raised their voice, changed the tone of their voice, directed at an older person, assuming that they could not hear? People insist on helping me with things I can do on my own. Again, in healthcare, we see that, and really need to work at helping our team members understand that we're there to help, but we should let them do as much as they can for themselves. We don't want to enable dependence for our people. So oftentimes ageism is very subtle, and it may not be intentional. Many times it's not intentional. It's just a way of life. It's microaggressions. It's a way that we communicate. But that's why we're having this program, to bring those things to awareness so that we can work on that, because it really shouldn't be, we shouldn't accept it as just everyday life. Another graphic from the National Poll on Healthy Aging, 82% of folks experience more forms of everyday ageism in their lives. This looked at adults in 9 categories of ageism, and they grouped, or 9 areas of ageism, and they grouped it into 3 groups. Exposure to ageist messages, that's again, hearing, seeing, reading jokes about old age or aging, seeing older adults in an unattractive or undesirable manner. 45% experienced ageism in interpersonal interactions. And that really is people assuming things about a person because they're older, assuming they can't use the cell phone properly, assuming someone has hearing loss, assuming they don't remember things because of their older age. And then 36% had experienced internalized ageism. And that's where I was talking about earlier, is really how you feel about yourself, how you feel about growing older. Do you feel like that's a good thing, a bad thing, depressing, lonely, or is it something that you're looking forward to? Those who spend more time watching TV, browsing the internet, and reading magazines were more likely to report 3 or more forms of everyday aging. So we do see a lot of it in our daily interactions. So where does ageism happen? Well, it happens pretty much everywhere. We're going to talk about a few places. The first place is the workplace. So it happens in recruitment, employment, retirement processes. More than a third of the workforce are people over 50. So you think about that. We have a lot of older folks in the workplace, but it's common. So I'm going to show you a real quick video on preventing ageism in the workplace. Let me get my mouse to go where I want it to go.
Cheryl, we're not seeing the video. You might have to change your screen to the video.
May have to do what?
Share the screen of the video.
Will I have to stop sharing to do that?
Potentially.
Give me a second.
So,
Can you see it now?
no.
No. Huh.
Mhm.
Okay. Well, best laid plans, right?
Right. It happens every time we do a program.
Sure.
Something goes, oh, it's not working. Yeah. So this is nothing new to us. You might have to stop sharing and then share that screen that the video's on.
Okay.
We can hear it, we just couldn't see it.
Yeah. Okay.
Yeah.
I only have 2 little videos, so we'll not go through this too many times, hopefully. Okay, now can you see it?
Yes.
All right. Okay, so I think there were some good things there that I found interesting. One is that we should be careful what we put on our resume. If we're searching for a job, how many of us put on there the year we graduated from college? Most of us do. And so is that something that we should consider not putting on our resume? The other thing I thought was really interesting was the likability score. I mean, I think we all know to not, to ask people the same questions and things like that. But what about rating everybody the same, even on a likability score? I think that's interesting, So I think there were some good points from that little video that are helpful. AARP has some great stuff that's helpful. Okay, tell me, are you seeing my screen again now, Jamie?
Yes.
Are you seeing my notes slide?
No.
Me either.
See presenter view.
Yeah, me either. That's not good. Okay, I may have to adjust here for a second. All right. Thank y'all for being patient. This is not my everyday job, is doing videos. So. Okay, hang on a second. Let me find my option here. Okay, now are you seeing?
Now we see the notes page.
Yeah, that's what I'm trying to get changed. And I had a great little drop down earlier that helped me with that. So let me see if I can find it again. I apologize. Maybe I won't show the video again. Still showing the notes page.
Yeah,
Wow, I apologize.
you're fine. With literally something will go awry each time we do a program. So
I know, it's never fails.
mhm. I think Zoom changes its system each night.
I always say there's little gremlins in here changing things for us, which is kind
Is
of,
there is there in the upper left hand corner says display settings?
that's what I'm looking for. Oh wait, maybe I found it. Taskbar. No. I had it earlier. It just dropped down and showed it to me, and I was able to change it.
It should be to the right of the taskbar display settings. Or it says show taskbar. Display settings is to the right of it.
Yeah. Nope. It is not there like it was earlier.
Of course it's not.
Hi, this is Judy Locke again.
Okay, I'm going to keep talking while I try to figure this out so that we're not sitting here. Okay, so where does ageism happen? We talked about the workplace. What about healthcare? How about elder speak? Has anyone ever heard of elder speak? What does that mean? It's a condescending way of talking to older adults that resembles baby talk. And we talk about this a lot in our in the setting that we're in with our caregivers, and trying to explain to our team that talking to our older adults in baby talk is not the way to do that. That's a condescending and definitely not the way we want to talk to our older adults. Oh, hang on a second. It's changing on me again, so hang on. Jamie, I don't know.
Is there a Zoom bar? Is it hidden under the Zoom Zoom bar? If that makes sense.
So at the very top of your presentation on the Black Notes side, is there something that has like a blue OK? If you click that OK, it should take your Zoom bar away, and then you should see display settings. And it's right next to it's show taskbar and end slideshow. It's right in between.
Okay, I'm gonna start all over. Okay, share screen. And
there it is.
okay.
We got it.
Hallelujah. Okay. All right. So back to the healthcare. So we also know that older adults are less represented in research, especially in drug trials. So why do you think that is? Older adults obviously have tons of medications that are prescribed to them, but yet they are the least likely to be in a drug trial, so underrepresented in drug trials. All right, so let's see. Higher education. Look at this. This was kind of astounding to me, that less than 1% of registered nurses are trained in gerontology. And that is kind of astounding to me. Less than 3% of medical students choose to take electives focusing on geriatrics, but yet we know that older adults will be a large part of who these folks care for. Less than half of pharmacy schools have a course in geriatrics, even though older adults 65 and over account for most prescription drug use. Less than 1% of physical therapists are certified as geriatric specialists. These are just astounding numbers to me that that we know to be true, because we at James L. West have a ton of students that come through and do their clinicals at James L. West, and we're so grateful that so many schools partner with us. But that's unusual to have so many clinical students coming through a nursing center, a residential care center like ours. So we're one of the few actual communities that train students that way. So we're grateful for that, but there's just so few. So look at that, dental schools as well, social workers, only 4% get training in geriatrics when case management and working with older adults is so prevalent. We are so grateful in Fort Worth to have the TCU Medical School and the UNT Health Science Center. Both of those medical schools send their students through James L. West to do training. And so we know that there are some places that are doing it. We have multiple, I don't know how many nursing schools that come through James L. West. So it does happen, but nationwide, if you look at this, that is the norm, that it doesn't happen. Obviously in the media, we talked about that a little bit, but we do see both negative and positive in the media. This picture you see here was an ad campaign that was done by a financial planning group showing the demeaning jobs that older adults would have to do if they did not plan for retirement. So it was a very unpopular commercial several years ago that came out, showed the older adults working in the mailroom and doing things like that because they did not plan for retirement for their financial future. So that was not a great example. Major causes of ageism may be the lack of age diversity among those who are planning the ads. So the median age for a manager in an advertising agency is 37 years old. The average age of a creative person in that industry is only 28. So if you think about who's planning these commercials, they need the training and need to understand the audience they're reaching, because the older adults control most of the financial resources in the United States today and are most popular consumers, yet they're not being marketed to as they should. Another example of media, an ageist example and a respectful example of our older adults. Here's another one. This one on the left was Wendy's years ago. And then another on the right that's more respectful. So you can see the compare and contrast of how we should be representing our older adults. So look at the terms here. The elders, oldsters, and old timers. What's your preferred term for senior citizen? So that was actually an article that was written in the New York Times. That was the heading for the article. And then look at these words that were listed as possible terms for older adults. How about that? Do you use any of those words in your day-to-day life? I hope you don't, but if you do, I hope you'll look at these and realize how wrong they are. Even the ones on the far left that say spry, zesty, feisty, active, spirited, full of life, those are derogatory because they're assuming they don't fit. They're used as a descriptor for an older adult because the assumption is they don't fit that. So just be conscious of the words that we use. Who's the most impacted? Older adults who have experienced everyday ageism have worse physical and mental health and perceive themselves as being worse off in health. And those who experience 3 or more forms of ageism every day, people aged 65 to 80, women, lower income, retired, and living in rural areas. Why does that matter? Whether you think you can or you think you can't, you're right. I love this quote because it really goes to us being how we see ourselves and how we see what's important and how we interpret the world around us. Positive views on aging among people 50 to 80. 85% feel more comfortable being themselves. These are people who reported positive views, even with the views on aging. 80% have a strong sense of purpose. These people have a good outlook. They feel more positive about aging and they think their life is better than they thought it would be. So they have a good outlook. They're resilient, positive thinkers. This is a World Health Organization quote. Ageism shortens older people's lives. Ageism leads to poor physical health and worsens health behaviors, delays recovery from a disability, affects mental health, increases social isolation and loneliness, and reduces overall quality of life. That's a pretty impactful statement if we think about ageism impacting people in those ways. So as professionals and people aging ourselves, we should be working hard to fight against that. So we know that positive perceptions of aging makes an impact. We know it's important. So we know that your perception may affect your physical and mental health. People who have positive views on the aging about themselves and others live an average of 7.5 years longer, make more new friends, and enjoy greater social support, engage in more preventative healthy behaviors such as eating right and exercising, and just enjoy a greater satisfaction in life overall. So that really important slide there that we should be, again, grasping and working hard to prevent ageism. A 25-year longitudinal study of older adults with positive self-perception. These are results of a longitudinal study that was done to show that 7.5 years longer life if you have a positive view. In another study, those who reported aging as a time of continued learning and development reported less illness and physical decline. They reported better functional health, such as ability to do household chores, walking upstairs, taking care of daily things, all if they had a positive view on aging. People with negative view on aging are at more risk for dementia. And older adults with positive self-perceptions of aging reported engaging in more preventative health behaviors over 20 years. So this longitudinal study really points out the importance of having a positive view. So what are some influencers of brain health? We're going to kind of pivot to brain health and dementia here for a few minutes, but being positive about our aging process, encouraging people to stay independent, to stay engaged, to stay independent on their activities, and eating right, staying socially active. We know all these things certainly attribute to positive health. So this is an important slide in that these are the things that we should be doing and encouraging others to do. So just for a minute, we'll talk about what is dementia. I know that most of you know this. This is just a review slide, and we're certainly not going to go into any detail about dementia, but here's the umbrella that we use a lot in our education about what is dementia. So when we talk about dementia, we're talking about all these things underneath. There's so many, many different forms. And so these, could include memory, it can include thinking and reasoning, focus, language skills, personality, sensory, movement. So it includes a lot of things, not just memory loss. There are lots of causes of memory loss and confusion. So we know it's not always dementia. Sometimes it's health conditions. Sometimes it's lifestyle choices, such as abusing drugs or alcohol. Sometimes it's depression. So there's lots of other things, but just know that it is not a normal part of aging. Memory loss, dementia is not a normal part of aging. Okay, so then over 68% of people around the world are concerned about getting dementia in later life. That was from a World Alzheimer's report. And one of the biggest fears for people growing older is getting dementia. And one of the biggest fears of getting dementia is losing the ability to drive, losing friends, being disliked by others. So there's some really important stigmas that go with dementia. And we've all heard the jokes about memory loss and those things. And so probably most of you on this call have been touched by somebody in your family, friend, colleague, or someone you care for that has dementia. So what are some harmful myths about dementia? Well, we know that a lot of people believe that memory loss is a normal part of aging and that it is not. And if you haven't taken one of our dementia classes, I would encourage you to do that because Jamie and Holly do a great job of dispelling all of these myths and educating with proper information. So if you haven't, I encourage you to enroll in some of those classes. Another myth is that nothing can be done. Many, many people believe that it's a terminal diagnosis and that it's the end of the world. There's nothing that can be done, and we know that's not true. There are lots and lots of things that can be done to intervene if you have dementia, but that's another one of the stigmas. That they'll get it if their parent had it, that they won't know who and what's going on around them, and we know that many people live successfully with dementia. And that placement in a facility is inevitable, and we know that that's not true as well. But we do know that people living with dementia get treated unfairly based on these myths and other myths and assumptions. And this can be really hard on the person who is living with dementia, but also hard on those that are caring for them around them. So we want to be sure and use some of these tips to while we're caring for people and interacting with people with dementia, to not impact them with these negative stigmas. Negative language is also often part of that, and one of the things that we work hard to say is not people suffering with dementia, but people living with dementia, because we know that people are still living. While there are some real losses, negative languages on their weaknesses is not the way to focus on it. So we want to talk about them as living with dementia and not a victim of dementia. So this impact of a dementia diagnosis. So there's a lot of studies and research out there about what the impact has on someone. This is from a 2021 AARP survey on perceptions related to the dementia diagnosis. And of course, it does carry a high level of stigma. And this study showed that younger adults were significantly more likely to have a negative perception of dementia than the older adult themselves. There was less fear among the older adult than it was of from the younger folks. Loss of driving privileges was one of the biggest fears, and that was by the older adult. Healthcare providers perceive their patients are more negative about dementia than they actually are. So the healthcare providers, in some cases, even withhold the diagnosis to not stress out their patient. Which is really a bad thing, because you want to have an early diagnosis. But the research showed that healthcare providers assumed it was going to be worse than it really was for the older adult. Significant disconnects exist between the healthcare provider on their perception of how their patients feel about dementia and the actual perception. A gap in knowledge about dementia exists among ages 40 and over. Over half of adults believe they will get dementia, far more than actually will ever develop dementia. Adults either don't know or aren't sure if there are any treatments for dementia or if there's a cure. And that's a big number of people really don't know. They just don't know if there's a treatment. Most adults do not want to be examined every year for dementia, even though they know the benefits of an early diagnosis, but they are accepting of baseline screenings, which is important for everyone to do. Healthcare providers and the older adults are in agreement that a healthy lifestyle benefits brain health, and that the general population are better off if they engage in healthy lifestyle. So that's all from an AARP study in 2021. Oops. Okay. Implications for a dementia diagnosis. We know that people over 40 do believe it's inevitable. They do believe that the treatments are not available, and they don't believe that there's a cure. And so okay, stigma of a diagnosis. So lack of awareness. And that's one of the things that we do at James L. West that we work so hard at, is to educate people about what it is, how to get diagnosed, why you should do screenings, why you should do early diagnosis. Harmful, misleading assumptions, negative language. We talked a little bit about that, belittlement, jokes. We've all made the jokes about having a senior moment, and no support after the diagnosis. So why is it important to have a proper diagnosis? Why test if there's not a cure? We know there's not a cure for Alzheimer's, but there certainly are treatments for lots of things. So first of all, you want to have a good diagnosis so that possibly you could engage in some clinical drug trials. There are some great clinical drug trials for Alzheimer's out there, but less anxiety if you know, better ability to plan for the future, better ability to plan with your family member, better ability to get support services, and just being able to focus on what's important in life. So there's a lot of reasons to get a good diagnosis. Preventing the stigma, educate yourself. That's the most important thing. And that's what we strive so hard at James L. West to do, is educate, educate, educate. Don't make assumptions. Dementia is a progressive disease, and it affects everyone differently. The diagnosis does not mean they will necessarily give up their daily routine. Many people are still very productive following a diagnosis. There's been lots of people who've written books and become speakers and all kinds of things after they've gotten a diagnosis. Be a friend. That's one of the most important things. Be a friend and still want to be around them and be part of their social network. And then, of course, encourage an early diagnosis and just be there for the caregiver as well. So many times we hear about the caregiver who becomes isolated because of the spouse's diagnosis, but that's when they need you the most. Change the narrative. You know, at James L. West, we work hard to change the narrative, and it really must start with you. Overall, the stigma of dementia, battling that starts with battling the stigma of aging. So we really have, they play hand in hand, and we really have to work at both. Presenting positive views of growing older to our youth, creating intergenerational programs. We have some great intergenerational programs at James L. West, at our day program and at our center. And it's just important to have those happening so that people can see what is important. Workforce development. I think that is a huge one. And the fact that we, you know, using James L. West as a clinical site for so many of the academic institutions is so important. And we're glad to be contributing to workforce development in that way. We start with students as young as Fort Worth ISD, Cristo Rey, some high school students from both of those places, as well as all the way through medical school. And another study by Mather Institute related to those who work with seniors found that the attitudes and language of employees impacted the seniors they serve positively or negatively based on their attitudes. So healthcare professionals really have to check their own attitude about aging. Some inclusive language. So this was the Gerontological Society recommended some of these terms. I just thought this was interesting that they actually had done some research and said to work on, to use these terms, use terms like older adult or older person for describing someone. Use first person language when speaking about an individual's disease or functional limitations, a person with dementia or living with dementia. Avoid terms that suggest helplessness, such as suffering with dementia. We talked about that. Avoid fatalistic phrases about an aging society that suggest it's a disaster, such as a silver tsunami. How many people have heard that? And talking about the increase of older adults in a negative way. And then the American Medical Association suggested that we use the older person, older patients, older individual, and not to be talking about othering, such as elderly, age, dependents, old, young, old, and we've all heard those terms as well. Some great age inclusive programs that I just want to mention here, and I won't go into detail about all of them, but just to give you an idea that there's lots of resources out here. There are tons of resources for people who are serving older adults, and age-inclusive programs such as age-friendly health systems. So this is a program that helps hospitals and doctors' offices, practitioners become age-friendly. And they have these 4 M's that they work on, but what matters, their medication, the mentation, and the mobility. And so this was created to help our healthcare systems be better age-friendly places for our older adults. And a few others that I wanted to list here. We have Dementia Friendly Fort Worth, and it's part of the Dementia Friendly America system. And so that's a great program to get involved in. Dementia Friendly Fort Worth is based here at First United Methodist Church with Gail Snyder as the director. That's a great place to get involved in your community or in a community near you, to make sure that businesses and public parks and all those places that older adults go are friendly for people with dementia. We have a little business card that we give to caregivers to carry with them when they take their loved one out. And if they're at a restaurant or somewhere and there's someone interacting with them that maybe doesn't understand the disease or understand that their loved one may have dementia, they can hand them this card, and it actually says, my loved one or the person with me is living with dementia, please be understanding. You know, so it helps at a restaurant or in a retail setting, the person that they're interacting with understand and be able to adjust and serve respectfully. Uplift Aging and Disrupt Aging is part of AARP, so that's a national initiative. And then Uplift Aging is a new initiative that's consumer facing here in Texas that was started by Leading Age Texas. If you get a chance and you get these slides, Jamie said she would send them out. There's a great podcast, a two-part podcast on Uplift Aging about growing older, and it's a real positive, upbeat podcast. So check it out if you get a chance. So what can you do? First, you can feel optimistic about your own self getting older. Stay healthy, have positive outlook, and don't fall into the trap of buying into that senior moment. When you have a forgetful whatever, don't automatically tag it as a senior moment. Think about the way you talk to yourself about growing older. Resist the temptation to tease others and resist those silly cards that we send to people and black balloons and all that about getting over the hill. Plan for your future care. Don't be afraid to talk about it and get ready for changes that might be impacting you. So plan for your future and be ready to face it in a positive way. Get with the new technologies. Don't let your age be a barrier to using new technologies such as email and social media and texting. Don't let folks be able to say you can't do that because you're old. So embrace it, learn it. Older adults are just as savvy at learning new things as younger adults. Manage being the recipient of ageism. So when you do encounter and someone does make a joke or a comment to you, respectfully call them out and say, hey, that didn't feel good. That was related to my age and I don't like that, but you can do it respectfully. Because when you compare it to racism and sexism, it seems to get people's attention and go, oh, you're right, that wasn't right. Resist giving in to the attempts to be swayed by the products that are out there on the market, all the anti-aging products that are being marketed to us and sold to us at exorbitant prices. Just resist that. Be healthy, stay strong, eat right, exercise, but resist the gimmicks. That is all I have for today. I want to thank you for your time. And I want to hop back up here and I want to show you this video because I was going to wait until the end in case it messes up again. But this is a great little video about rethinking. So hang on, and let's see if we can get this to play. Okay. Can you see yes or no?
We don't see your screen change now.
Okay, hang on just a second. Let me stop sharing. That will end the slideshow. Okay, and now I'm going to share again and show you the video. Okay, now do you see it?
Yes.
All right, that is the, hang on, hang on. Okay. All right, well, thank y'all for your patience with my technology challenges, unrelated to my age, but more related to lack of practice. So thank y'all for your time and attention. And the little video at the end I love because it gives you a different perspective. You immediately think the gentleman is having trouble with his cell phone, but in reality, he was putting a filter on. So I love it. And I hope that you'll take time to think differently about aging.
Thank you, Cheryl. That was great. And it had me thinking a lot about particularly the words we use, like with people with dementia suffering and all that. And I had to think, well, what do I use when it comes just to older adults, particularly with my family, you know? So thank you so much. And there are, if there's any questions, you can either put them in chat. We have a few minutes, or if you want to unmute yourself, that would be great as well if you have questions or comments. I'll remind everybody you will get a follow-up email this afternoon with a copy of the presentation. We'll make sure that you're able to click on the links to see those videos again, or share those videos possibly with other people. We also welcome you to share the slides with those that you think might need this information. Everybody needs the information, so just share, just share it out. We'll get you information on our upcoming programs and a link to an evaluation as well. We ask you evaluate it. If you are wanting CE credit, we get 1 free hour for nursing, social workers, LPCs, and then a certificate of attendance. You must complete the evaluation, and if you'll give us about 3 to 4 weeks to get those certificates back to you through email. And in a couple of weeks, probably a week and a half or so, this program will be uploaded to our YouTube page, and we invite you to visit our YouTube page, share this video, share this information, and then peruse all the other videos we have on there as well. And there was a question that came on, I believe. What can you do if you suspect ageism when applying for jobs? Or how can we determine if we may be discriminated in the hiring process? Good question.
Well, I think there were some great tips in that little video about how to adjust your resume so it's not so blatantly obvious your age, because that's, you know, in the beginning, that's not your qualifications. You don't necessarily need to share information about that. So certainly adjusting the way you're applying for the jobs. But if you believe blatant ageism has happened, then there are methods or avenues to take to report that. The EEOC is certainly an area that you could go to and report if you do believe that it's blatant against you as an age. But I would just work on your approach as well. I think that's the best place to start.
And Dora brought up a good question. She said in her community, we say papa, mama, auntie, and uncle. So how do you take in those cultural aspects and considerations?
So when I guess you're referring to when caring for someone and using these terms,
yeah.
You know, elder speak is really calling someone these names without their permission. So we have had, you know, I can't tell you how many times wait staff have called me, not at James of West, but in a restaurant, sweetie, honey. When the waitress calls you that, it drives me nuts. But you know, for caring for people, if that's their pet name that they request that you call them, or that their family requests that you call them, then we certainly care plan that and allow that to be so. But it should be at the request of the person, and not just your little pet names. It should not ever be that. And in fact, we ask our staff to, you know, to address people by Mr., Mrs., Doctor, their first name, however the person requests to be addressed. And sometimes it is Papa or Mama. Yeah.
Awesome. Any other questions or comments? Well, sure. I don't know if you're seeing chat, but there's a lot of thank yous, great information, wonderful presentation. And we appreciate y'all taking the time to be here and taking this information. And we just ask that you share it. Yes. Make changes as you might need to in your own personal life and career, and then share this information. Like Cheryl said, education cures a lot of things. And we ask you to continue to educate others as you might hear words or actions or practices as well. Make them more age inclusive.
Yes, I agree. Thank you all for your attention, and I appreciate you sharing and changing the narrative. That's what we need to do.
Right. All right. Thank you all so much. We'll see y'all next time.
Thank you.